The Speaker shall nominate trained members of Parliament to vet the candidates. I nominate the chairperson will be Honorable Fox Odoi. We shall have Honorable Enos Asimwe, Honorable Javira Semwanga, Honorable Lake Sharon Balamoi, Honorable Wilson Kajwenge, Honorable Sylvia Nayevale, Honorable Boniface Okot, Honorable Yusuf Mutembule, Honorable Isaac Sejova, Honorable Rose Obiga, Honorable Lokwang Hilare, Honorable Teddy Nambose, Honorable Mwanga Chivumbi, Honorable Joan Achom Alobo, Honorable Peter Court, Honorable Asuman Basaliro, Honorable Joseph Koluo, and Professor Elijah Mushemesa. And then Honorable Alinda Auma. I have already issued a notification of the days of nomination, and if approved by this House, the names of members shall sit to execute their mandate on Friday, 23rd July 2021, and report back to the House on Monday. I implore all of you to acquaint yourself with the provisions of the Treaty for the Establishment of the East African Community. That is Rule 12 and Appendix B of our Rules of Procedure, so as we ensure that we have a smooth election for our representative of Yala. Honorable members, on the order paper, we set to receive a statement on the status of government intervention against COVID-19 pandemic from the leader of government business in the House. I urge you to listen attentively so that you can be able to have a meaningful debate. I have also been notified that the Honorable Leader of Opposition intends to give a motion, to move a motion to the House to adopt the recommendations for the debate in the Prime Minister's statement. The clerk should take note and call it up for appropriate time. We were also programmed to receive an interim report from COVID-19 task force of the Katutu, but I have been informed the teams are still in the field, and now that we have committees in place, I urge the committee of Katutu to present the report on Thursday next week without fail. We shall also be receiving responses to the urgent questions that were raised on 14th. We'll receive responses from the various ministers on what was raised. I thank you for your kind attention. I now invite the House to take a decision on the membership of the verification committee that I have presented. I invite the clerk to table and read out the list of members again for a decision to be taken.
The names of the verification committee include the following: Honorable Enos Asimwe, Honorable Derrick Orone, Honorable Javira Semwanga, Honorable Lake Sharon, Honorable William Kangwaje, Honorable Sylvia Nayevale, Honorable Boniface Okot, Honorable Yusuf Mutembuli, Honorable Isaac Sejova, Honorable Rose Obiga, Honorable Hilary Lokwang, Honorable Teddy Namboze, Honorable Mwanga Chivumbi, Honorable Joan Achom Alobo, Honorable Peter Okot, Honorable Asmani Basalirwa, Honorable Joseph Andrew Koluo, Honorable Elijah Dickens Mushemeza, Honorable Linda Auma.
Right,
those
Honorable.
are the questions that have been
No,
read.
Right, Honorable.
Yes.
Just for the record, to correct the name of Honorable Kangwaje, is Honorable Wilson Kangwaje, not William. Is Wilson Kangwaje. No, sorry.
Kajwenge,
Kajwenge, it's Wilson
not
Kajwenge.
Kangwaje,
It's Wilson Kajwenge, not William Kajwenge.
Kajwenge.
Yes, from Nyabushozi.
Correction received. I now put a question that those in favor of the verification committee to the Yala candidates say aye, and those against, the ayes have it. Yes.
Thank you, Honorable Speaker. And I want to thank you for the communication you have made. But I have two procedural issues. The first one is about the Clerk of Parliament. I have been a member of the Accountability Committee in Parliament, and what we heard from the President was that she is retiring in public interest. The little I know, if someone retires in public interest, he must have committed some offenses. Could this be the fact? And if so, Madam Speaker, we've not had such. Of course, the President can transfer his people, civil servants, as the rules provide, but wanted to know, Madam Chibidige, what are the offenses that might make her miss her retirement benefits? Right now, Speaker, the other procedural issue is, I am tired of being on radio, on air, and the members of Parliament have not got any answer about the whereabouts of the Speaker of Parliament. Honorable Speaker, we want to know what is the fate of the head of this institution. Honorable Speaker, why? We are 520 members of Parliament. Even if he's down, he must know that he's down, because when Madam Kadaga was sick one time, the House was informed, but none of us is coming out to give the public what is happening to the Speaker of Parliament. Is he held incommunicado? We would like to know. What is the fate of Madam Speaker, the Right Honorable Jacob Olanya? Even the Acholis are so quiet. They are not talking about their son. The Parliament is quiet. We cannot keep there without knowing the fate. So would it be procedure, Honorable Speaker, to inform us the fate of the Speaker of Parliament? Otherwise, even my mother is asking me, where is your Speaker you elected? We don't know what's happening to this big man, the head of this institution. But I was on procedure.
Yeah, thank you, Honorable Member. Right Honorable Speaker, Honorable Sehongo raised a very important concern. Right Honorable Speaker, wherever we are in our villages, people from northern Uganda normally ask where the Right Honorable Speaker of Parliament is. As a result, so far we have failed to inform our people where the Speaker is. We normally follow on social media, and we don't know exactly where the Speaker is. Right Honorable Speaker, the information I like to give to my colleague is a very important concern, and you need to clarify.
Order. There's an
Speaker,
order from Honorable.
I was on procedure and it cannot have order. It is a procedural matter. And the Honorable
Honorable
is a senior
Sehongo.
member. Yes, Honorable Speaker.
Honorable Sehongo, can you conclude?
Madam Speaker, as I conclude, the issue is, even when Boris Johnson became sick, government informed the public and the Parliament. In Cameroon, they have a president who is never in their country, but when he's going out, the country is aware. So can we know, Right Honorable Speaker, the fate of our Right Honorable Speaker of Parliament, Jacob Olanya? Thank you, Honorable Speaker. That's the procedure matter.
Thank you so much, Honorable Sehongo. And I really request that we go into a very serious debate on what the right Prime Minister is going to present. But just to allay your fears, Honorable Seunga, I'm talking to you. One, there is a speaker in this house, and the speaker is here. There is no vacuum. That's one. Two, the issue of Kibirige, Madam Kibirige, the appointing authority has powers to disappoint. So that question can only be sent to the president, not to the Speaker of the House. Madam Right Honorable Right Honorable Prime Minister, can you present your statement on the status of government?
Item number 3, statement on the status of government's intervention against the COVID-19 pandemic.
Madam Leader of Government Business,
Right Honorable Speaker,
please go ahead.
Right Honorable Speaker and Honorable colleagues.
Members, some silence as the Leader of Government Business is presented.
I would like to start by thanking you, Right Honorable Speaker, for giving me this opportunity to update you and honorable colleagues about the ongoing response to the COVID-19 pandemic. Permit me to appreciate Parliament for the support, timely provision of resources for the response, monitoring, and above all, educating the public about the COVID-19 prevention measures. Right Honorable Speaker and colleagues, I would like to appreciate the National Task Force on COVID-19, Ministry of Health, and the Parliamentary Task Force that has been in the field following up on the response. Colleagues, the war against COVID-19 is a tough one, engulfing the whole world and our country for now 16 consecutive months. However, this is a war we can only win when we are united, working together for a common purpose and for the generations ahead of us. Honorable Speaker, I would like in a special way to thank HT the President for the visionary leadership he has consistently provided to the country in the fight against COVID-19 right from the beginning. Uganda is definitely lucky to have him as president. Honorable Speaker and colleagues, let me also acknowledge and appreciate the general public for their resilience and support in this fight. It is encouraging to note that currently Ugandans have taken seriously the issue following the standard operating procedures, such as wearing masks and other measures required to prevent the spread of COVID-19. Further, we are grateful to all our frontline workers in health, security, and all other essential services. As a nation, we thank you for standing at service for your countrymen and women. Honorable colleagues, as of 20th July 2021, the country has registered 91,162 confirmed cases of COVID-19, with 70,377 recoveries and 2,425 deaths, bringing the total fatality rate at 2.49 of deaths among those affected. Currently, there are 746 admitted in health facilities. These are very disturbing figures. They are still very disturbing figures. But we have hope that the current wave is on the downward trend. However, as a nation, we must remain vigilant, resolute, and consistent in the observance and compliance of all SOPs at all times. That Honorable Speaker, allow me to request colleagues to stand up and observe a minute of silence for the departed due to COVID-19. May their souls rest in eternal peace. Amen. As you are all aware, on 18th June 2021, HE, the President, guided by a scientist and the prevailing COVID-19 trends at the time, announced a second lockdown. This was meant to reverse the rapid spread of the pandemic. I'm glad to report that the daily caseload, including the rate of hospitalization, have significantly dropped in the past 2 weeks. This is what the lockdown was intended for. To slow down the
Right Honorable Speaker, for record, I'm Honorable Court BTEC Jr. I don't know whether it is procedurally right for the Right Honorable Speaker to give us a different document, and she reads a different document. The intention of this report is to be debated, but I don't think I will be able to substantially debate the report that the Right Honorable Prime Minister is reading, which is different in text and in form substantially from the one that I have.
I am equally following the same report. She is actually reading the report but making emphasis on something. Madam, can you now read the report?
Right Honorable Speaker, I updated this report to match the current trend, because the figures are the only ones that are different.
Right Honorable Speaker, Right Honorable Prime Minister, read the report as it is.
Okay.
The report is going to be read as it is. Can you sit down? Can you read the report?
Procedure, Madam Speaker. Madam Speaker, procedure. Madam Speaker,
Zoe,
this is Chamaswet Kisos. Is it procedure right for us to proceed with business when we are not getting anything because of the poor public address system, Madam Speaker? In fact, I'm really dozing, and I've not even gotten anything from the other side. But I think this other side is a bit lucky because they can get what the Prime Minister is saying, but we are not getting anything at all.
Clerk, can you sort out
We don't have even the report.
Thank you for that information. Clerk, can you sort out that?
Right Honorable Speaker, can I proceed?
Please just hold on a minute so that the behind people are able to hear you. You're raising a procedure. We are sorting out issues. People are not hearing. Wait and people first hear what you're saying.
Right Honorable Speaker, am I now audible enough?
Members behind, can you hear?
Madam Speaker, procedure. Madam Speaker, procedure.
Can I continue now? Just a minute, we sort out something administrative.
Thank you.
Prime Minister, can you go ahead? Yes, honorable colleagues, the updated report also is on your system.
Procedure, Madam Speaker.
Honorable members, there was a report which was uploaded the other day.
We haven't gotten a report, Madam Speaker.
That was the first report. Listen, today there is a report which is dated 21st July 2021. That is the report that is being read. Is that the report you're reading? Yes. Yes, leader of opposition. When your leader of opposition is speaking, you sit down.
Right Honorable Speaker, I thank you for your indulgence. I have listened to the Prime Minister's submission relating to members' concerns on the additions on her statement that were not received a priori as per the rules. The rules have no provision for an extra, additional, or doctored report. And it's only the Speaker to guide this House as to whether I received the additional copy about 15 minutes ago, and I'm trying to contend with the additional contents. And I want to put it to the Prime Minister that it's an act of disingenuity to try and move the House to debate matters in haste as if her statement is a matter of urgent national importance that she had no prior knowledge to. I would like to ask the Speaker to guide the House, probably demand that the Prime Minister sticks to her original statement, and if she has additional issues, she'll bring them as a way of clarification. Otherwise, the confusion she's bringing to the House has no space in the rules, Right Honorable Speaker.
Leader of opposition, remember when we adjourned the House, we agreed the Prime Minister should go and adjust her report to respond to the questions that were raised in regard to COVID-19. Unless if we are saying that is not captured, then she should stick to her original report, then answer those questions afresh.
Thank you, Right Honorable.
But you should also appreciate if she's reporting in terms of figures, the figure on Thursday is different from a figure of today. That can be adjusted. Is that agreed?
Thank you so much, Right Honorable Speaker, for your wise ruling. I'm glad to report that the daily caseload, including hospitalization, have significantly dropped in the past 2 weeks. This is what the lockdown was intended for, to slow down the rapid transmission and restore our health system that had been overstretched and degraded by the huge numbers of patients. Evidence from elsewhere, and from the fundamentals of infectious diseases control show that lockdowns and restrictions in movement of persons slow down and reverses the rate of transmission. Given the long incubation period of the virus of 14 days, our scientists and the Ministry of Health had predicted that the reversal may happen after 3 to 4 weeks. Preliminary epidemiological and clinical data shows that we may have passed the peak of the current wave. However, we must be cautious on this apparent downward trend, given COVID-19 unpredictable microdynamics detected by community and social interactions which vary. The Ministry of Health, working closely with the local governments, are monitoring this situation closely. Right Honorable Speaker and colleagues, in the 42 days lockdown, government is doing the following: enhancing measures to interrupt transmission of COVID-19 among healthcare workers and communities. We are strengthening measures to control transmission within communities through the district and village task forces. We are streamlining and strengthening home-based care for COVID-19. We are continuing with vaccination. We are addressing gaps that were identified in the last wave, such as enhancing oxygen availability, strengthening port health at border points of entry, increasing the number of vehicles for surveillance, and training more health workers on critical care. Since the entry into the second wave of COVID-19 pandemic, which is driven by the presence of Delta variant, there is an increased demand for care of people with COVID-19. The Ministry of Health continues to implement the home-based care strategy, which started in the first wave. This strategy reduces pressure on health facilities from overload with patients who have no symptoms or those who are mildly sick and don't require sophisticated clinical care and can be monitored in their homes. In this regard, that Honorable Speaker, the Ministry of Local Government received 52 billion to facilitate COVID-19 response at local level across the country. The disbursement of funds is as follows: district local government, 150 million, cities, 150 million, municipalities, 100, village health teams, 300 per village, and village task force, 100 per village. This will support their implementation of the community-based engagement strategy for COVID-19 response, as well as the enforcement of the presidential directives at district and community level. The objective is to ensure that all people in Uganda are aware, organized, empowered to participate actively in the prevention and control the pandemic. That Honorable Speaker, unlike the first wave, where the majority of severe and critical cases were above the age of 60, the second wave is characterized by a shift to high numbers of cases among the age group below 40. The rapid rise in the number of cases has had an overwhelming impact on the provision of clinical care. There has been a significant increase in the number of cases admitted to isolation facilities. Again.
Thank you, Right Honourable Speaker. Right Honourable Speaker, the Right Honourable Prime Minister, she's making us to get confused the more. You guided very well that the Right Honourable Prime Minister should first read the whole report and emphasize on any other additional information. Right Honourable Speaker, what she's reading is quite completely different from the documents we are having. Right Honourable Speaker, I request through you, let the Prime Minister read first the first document, and she will supplement on the other information that she feels like. Otherwise, we are getting more confused and we are not following what is going on. I beg to move right on, Speaker.
Do you have the new report? Honorable Gilbert, do you have the new report? It is uploaded. Check on your whatever, on your WhatsApp. Members, we've agreed. The leader of opposition has a right to reply. He's going to reply and respond to whatever is being presented. Leader of opposition?
Right, Honorable Speaker.
Leader
Right,
of
Honorable,
opposition?
before you proceed, I think to settle the nerves of the House is to draw the boundary for the Right Honorable Prime Minister that we can avoid overlapping statements not available to the members. That just like you had guided, probably I thought she had picked her old copy and that we had agreed that in her response to the debate, she would use that space to bridge the gap between the information available to the members hitherto and then bridge them with additional information. Otherwise, she is increasingly sowing confusion and making the entire presentation look scattered, Right Honorable. If she had stuck to your guidance, would be far, I suppose.
Yes.
Right, Honorable Speaker. The issues of COVID keep evolving. There are some issues that were asked the other time, and you guided that I should embed those very issues in my report, and I'm answering the same. Right, Honorable Speaker, I request you to provide. Right, Honorable Speaker,
Proceed, Honorable Speaker.
Members, we in this very house, and I was the one chairing. I told this Prime Minister to avoid you repeating this kind of things. Can you go and include what has been raised into your report? Huh? Now, if you cannot respect the decision that was taken, that was the basis of sending back the report. Now, so for me, if what we asked has been included in the report,
order.
And I want you to check where the old report was uploaded is where the new report is uploaded. Check where the old report was uploaded is where the new report is.
Procedure, Madam Speaker.
Procedure,
Speaker.
Procedure, Honorable Speaker. We are seeking for
Do you have the new report?
No. Right, Honorable Speaker.
Order.
Members, do you have the new report?
The Right Honorable Speaker.
Madam
Order.
Speaker, procedure.
Order,
Procedure, Madam Speaker.
There is an order there.
Madam Speaker, is it really in order for honorable members to keep confusing the House without referring to any specific date of the report they are talking about? I have a report that was shared on 14 July 2021, and what our Right Honorable Speaker is presenting is not any different. They are only different in the data, but not the content. Thank you.
Members.
Procedure,
Members.
Right Honorable Speaker.
Members, please first.
Procedure, Madam Speaker.
Members first
Right
sit.
Honorable Speaker.
Right Honorable
Procedure,
Speaker.
please.
Members first sit. Members, please first sit. There was a old report of 14th. It was uploaded, yes or no? There is a report of 21st. It has been uploaded. Madam Clerk, can you tell us whether you uploaded or not? A moment. Let's sort out things one by one. Let's sort out things one by one. But they're on white, it's everywhere. The report. Members, can you allow me chair this house? You asked for an update of a report. Huh? Order. Prime Minister, go ahead.
Thank you so much. Right Honorable Speaker, on May 2021, for example, admissions were 10 to 20 new cases daily, and this increased to an average of 120 cases daily.
Madam
The majority
Speaker, procedure.
of the admitted have several and critical conditions that require hard dependency and intensive care
Madam
support.
Speaker,
This
procedure.
drastically increased the oxygen requirement.
Prime Minister, just hold on.
Each
Prime Minister.
COVID-19 patient.
Prime Minister, hold on. Madam, the House, I request of you, take note of what has been added. Let's follow what is happening. Unless if you're saying, we still adjourn the House because of this very important issue. Huh? I am not allowing any procedure matter. Can we?
Right Honorable Speaker. For example, the other day.
Madam Speaker, procedure.
Madam Speaker, can we listen to the report and we debate, we bring issues to the report?
Madam Speaker,
listen
when
to the
we
report.
say it is uploaded, do we already have iPads in order for us to say it is uploaded?
Your phones, WhatsApp. Prime Minister, go ahead.
Procedure.
Right Honorable Speaker, let me give an explanation. For example, Right Honorable Speaker, the other time members said they wanted to have copies of the beneficiaries. I have come with copies, and that was not in the last report. So allow me to present.
Then give out. Speaker. We cannot.
I have come with
from your hands.
The other time I had not come with the beneficiaries.
Out.
It is here. Allow me to present members.
Madam Speaker.
Procedure.
Madam Speaker, procedure.
Procedure, Madam Speaker.
Right Honorable Speaker, I request that you make a ruling and we move.
Procedure,
Members,
Madam Speaker.
members, can I have order in the House?
Proceed with the speech.
Not there.
Proceed.
Members.
We proceed.
Thank you so much, Right Honorable Speaker.
Members, I am going to make my ruling on this. Let's listen to the report, take note of the report, and I want to tell you, whichever member is going to continue disturbing, I will apply Rule 79.
Can you read the report? Right Honorable Speaker, thank you so much for the wise ruling. In May 2021, for example, admissions were between 10 to 20 new cases daily, and this increased to an average of 120 cases daily. The majority of these admitted have severe and critical conditions and require high dependency or intensive care support. This drastically increased the oxygen requirement. Each COVID-19 patient consumes 4 to 6 cylinders per day, as opposed to 1 to 2 cylinders per day for a non-COVID patient. In some extreme cases, patients with severe lung damage would even require up to 12 cylinders of oxygen per day. Right Honorable Speaker, government has been addressing the issue of oxygen and aims at a permanent solution. In the meantime, government and partners have procured several oxygen cylinders to supplement the needs of the isolation facilities. Oxygen from the pressure swing adoption system has been in the use in Uganda for a long time. This oxygen is produced in a gaseous form and cumbersome to distribute to the entire country. To address this, government has begun a process of procuring and installing psychogenic, that is liquid oxygen plants, whose oxygen purity is as high as 99.7%. The shift to liquid oxygen is guided by the very high purity levels, the ability for production and storage of high volumes of oxygen, and the less cumbersome way of transporting the psychogenic oxygen tanks to fill the cylinders at different facilities. Psychogenic oxygen plants will be installed in all regional referral hospitals and at national medical stores to serve the needs of the national and specialized hospitals for both COVID-19 and non-COVID patients. 4 units will be installed at the national medical stores to produce 5,000 cylinders per day. Government is also procuring 7 psychogenic oxygen trucks to deliver oxygen to general hospitals and health center force. This will eliminate the cumbersome process of carrying cylinders to and from the health facilities. Psychogenic trucks carry liquid oxygen at very high pressures and huge volumes, which can be converted into gas at the facilities and filled into the cylinders. Over 6,000 cylinders will be procured and distributed to all facilities for this purpose. That Honorable Speaker, today, I'm happy to report that I received 300 cylinders from Nairobi breweries this afternoon. The requirement for huge amounts of oxygen and medical supplies include medicines and personal protective equipment for the healthcare workers has driven the cost of COVID-19 treatment way above what an average Ugandan can afford in private health facilities. Some private health facilities and providers were reported to be charging exorbitant prices. The Ministry of Health and my office engaged them to understand the dynamics and support reduction prices. It was discovered that the cost drivers were personal protective gears, especially the coverall, huge amounts of oxygen required for critically ill patients, multiple drugs required for those with severe ailments, and the necessary laboratory tests to monitor the patient's condition. It was resolved that the private facilities should stick to the Ministry of Health guidelines for the management of COVID-19 patients to avoid unnecessary costs, which include the burden to the patient. Colleagues, in the absence of an effective treatment, vaccination remains an important control measure for COVID-19 pandemic. If all eligible persons are vaccinated, we can open our economy and avoid the lockdowns, which has driven our population into more poverty. Government is therefore using a multi-pronged approach to secure vaccines for the 20 million remaining eligible individuals through the following acquisition protocols. Direct purchase of vaccines through COVAX facility. Direct purchase of vaccines through African Union. Direct purchase of vaccines from the open market. Various vaccines have been listed for use in Uganda, including AstraZeneca, Covishield, Pfizer, Johnson & Johnson, Moderna, Sinopharm, and Sinovac. In the content of the global cast of vaccines, government through our missions abroad is aggressively searching for the available source and will procure the vaccines that we can access. Many of you will recall that in the budget speech, Uganda shillings 560 billion was allocated to COVID-19 vaccinations. The Minister of Finance can affirm to this and its availability. This may not be enough, as this August House may be called upon to provide additional resources as is required. Honorable Speaker, when HE the President announced the second lockdown to prevent the rapid spread of COVID-19 on 18th June 2021, he mentioned that government was aware that the lockdown measures were likely to negatively affect the poor and the vulnerable persons across the entire country. In order to address this, HE the President directed me as the Prime Minister and the Minister of Gender, Labor and Social Development to, one, identify the groups that depend on daily earnings in urban areas. Two, identify interventions to take care of their needs. Honorable Speaker, I wish to inform you that since that directive was made, government undertook verification exercise of the vulnerable people in Kampala metropolitan area, all cities and municipalities. And the Minister of Finance released 53.5 billion to provide relief to those who were considered. I will now provide the progress report as below. The total number of targeted beneficiaries, households, was 501,107 across the cities and municipalities. The total number of beneficiaries paid as at yesterday, 4 p.m., totals to 400,135 beneficiary records had been submitted to the bank and paid, which represents 82.5%. That totals to 41,350,400 shillings, Uganda shillings. Honorable Speaker, number 3, failed submissions and payments. Out of the total number of 1,107 records submitted to the ministry, a total of 87,603 records did not pass the verification requirement by telecom databases due to the following reasons. One, invalid ID numbers presented. Telephone numbers registered under different names from the national ID names. Non-existence or non-registered telephone numbers. Non-mobile money registered numbers at payment level by bank. The failed numbers have been sent back to the cities and municipalities for correction before payment can be made. The clerks have been guided and trained by the Minister of Gender, NITAU, on what to do. Accordingly, Honorable Speaker, and in light of the directive from Cabinet, the following categories of people have been the beneficiaries of the cash transfer, the Nabanja cash. These are the categories: the bus and taxi drivers, conductors, baggage couriers, wheelbarrow pushers, touts, traffic guides and loaders in taxis, bus parks and stages, In the other major commercial centers, such as Chikubo, barmen, DJs, barmaids, waiters, and bouncers, bar, gym, restaurants, and restaurant workers, food vendors in the bus taxi parks and arcades, artists, musicians and comedians, border riders, special hire drivers and Uber drivers, saloons, massage para workers, teachers and support staff in private schools and teachers in government schools not on government payroll, car washers, slum dwellers, commonly known as ghetto residents, street and food vendors, shoe shiners, and cobras. Right, Honorable Speaker, this emergency intervention was a short-term relief and not meant to address the high poverty levels, which can only be dealt with in the long term. I humbly request that you explain this intervention of extending support to the immediate COVID-19 vulnerable caused by lockdown in the Kampala metropolitan area, cities, and municipalities to your people, so that they understand that we are not discriminating against anybody. As we continue to mobilize resources, other vulnerable categories may be considered. Besides, other government programs such as Women Fund, EMIOGA, Operation Wealth Creation, Youth Fund, SEDGE, Disability Grant will continue to support other vulnerable groups. In addition, the parish model program is on course this first quarter. Honorable Speaker and honorable colleagues, this exercise of providing relief support to our people has shown us that we need, one, to invest in collecting, analyzing, and documenting data about our citizens accurately. For example, in the process of verifying beneficiaries, we found that some of the people's telephone numbers were registered under different names from those on their national identity numbers. In other cases, beneficiaries submitted telephone numbers not registered on mobile money. While in other cases, beneficiaries had telephone numbers that are not registered with the telephone companies. Such gaps and inconsistencies have caused the delay and affected this exercise dearly. This is the first time government is carrying out intervention of this nature in a short time and in such a magnitude. Therefore, challenges are bound to happen. The important thing is that lessons have been learned, and we shall do better in similar programs in the future. Honorable Speaker and honorable colleagues, regarding the management of transport and movement of essential vehicles in essential sectors, the Ministry of Works, Transport, together with NITA-U, developed an online application where details of all persons and vehicles permitted to move during the lockdown have been managed. Under this system, 28,916 movement permits out of 36,479 applicants have been issued. Some of the 7,173 applications are pending approval, while others were rejected. Those rejected did not meet the strict criteria of complying with the essential services. In addition, Ministry of Works Transport continues to facilitate travels for emergencies such as medical appointments and burials. To facilitate cross-border trade, HE the President directed that Entebbe International Airport remains open. This continues to be the case while following strict SOPs, such as routine disinfection of premises, installation of automatic sanitizers, mandatory PCR COVID-19 test for airline crew, and testing of travelers. Right, Honorable Speaker and honorable members, enforcement to ensure that all schools and institutions of learning remain closed for 42 days has been effectively undertaken, and crackdown on the errant ones continues. The Ministry of Education and Sports and the Ministry of Health are developing a comprehensive plan for a phased reopening as we work towards mass vaccination. The Ministry of Education and Sports has put in place alternative learning initiatives and will continue to perfect them for the rural areas. I would like to conclude by saying something about National COVID-19 Fund, which was established by HE, the President, to mobilize donations for COVID-19 response. Through that effort, 29 billion was raised, and we thank all Ugandans and friends of Uganda from all walks of life who contributed to this cause. This donation was banked on the COVID-19 account opened in Stanbic Bank and transferred to the Consolidated Fund directly. On 28th May 2020, the appointed management of the fund met HE, the President, and agreed to use the 23.9 billion of the fund to purchase 282 double cabin vehicles, to give at least a vehicle to each district, municipality, and cities in Uganda to support the activities of their response to COVID-19. Another 3.3 billion was earmarked to construct a blood bank at Soroti Regional Referral Hospital, while 2.4 billion has been put to construct port health facilities at Chanika and Vura, while Busia and Maraba are being constructed under Government of Uganda funding. That Honorable Speaker and colleagues, I am pleased to inform you that 121 out of 282 vehicles have already arrived in the country and are undergoing clearance, including provision of number plates, while the rest are in transit and expected anytime soon. In addition, I would like to inform you, honorable colleagues, that at the start of the response to COVID-19 pandemic in March, government decided to procure an additional 38 ambulances to add on the existing fleet to support emergency medical services. By the end of last year, these ambulances, which include 3 water ambulances, had arrived and are currently in use in various parts of the country as per the emergency medical services policy and strategy. Honorable Speaker and colleagues, this is an updated report as of today, like I told you earlier. I'm aware of the presence of the Parliamentary Task Force on COVID-19 in the field. Obviously, government is aware of those gaps that need to be addressed. There is no system without challenges globally, and the government is committed to put in place mechanisms to address these challenges. In regard to the management of COVID-19, we are not using all hospitals as isolation facilities. There are numerous other patients that require medical care for other conditions. As such, the general hospitals, Health Center 4s and Health Center 3s have been reserved for such cases. In any case, even the isolation facilities in the regional referral hospitals are away from the areas where other conditions are treated. That's why the Ministry of Health emphasizes the need to admit only severe and critical cases that require specialized care, while the rest can be treated at home. I would like to end by sincerely thanking you, honorable members, for the support you have consistently given to the response towards this pandemic. Together, we shall win this war. Allow me to lay on table, ladies and honorable members, as you guided right honorable Speaker the other time, a copy of the beneficiaries for the relief payment who have benefited from this COVID relief fund of Guru City.
Thank you.
I will bring them at once. You can see how big the volume is. This is only Nakawa division. So I have decided, Honorable Speaker, to bring a flash containing all this information of the beneficiaries we have given this money. Right, Honorable Speaker, like I told you, we are struggling and we must fight corruption up to the letter. That's why we are in an era of accountability and transparency. Allow me to lay on table these documents.
Members, as the minister lays on table the list of beneficiaries of the so-called Nabanja cash, I am ordering PAC local government and PAC central to scrutinize those documents and confirm whether those are the right beneficiaries and report back to this house. The report has been presented.
Right, Honorable Speaker, allow me to say thank you, especially for the guidance you gave so that I can read my report. Thank you so much.
Member, thank you for your cooperation. We've had a report from the Prime Minister. Before I invite the debate, can I have, you're aware that the law has a right to reply. Can we have the leader of opposition?
Thank you for your kind indulgence, Right Honorable Speaker. I would like to appreciate my dear sister, the Prime Minister, for hazarding to present this report in whatever form it is. We shall take it. We shall with time appreciate your methods of work and adjust accordingly, or invite you to stick to the tenets of the House. I will use very few minutes, Right Honorable Speaker, to make brief commentary on the presentation of the Right Honorable Prime Minister to this House. Right Honorable Speaker and colleagues, on the 14th of July 2021, we received the response of the Prime Minister by way of circulation. It should be noted that from the onset, the statement is indicative of the appalling approach of government in the management of COVID. Its response is largely deficient of the required momentous strides that merit commendation. I should have done as a matter of courtesy to the Honorable Prime Minister. I am hesitant to say that on another day I would have condemned her, but I will reserve the condemnation to another day. Right Honorable Speaker, every citizen is feeling the wrath of having a government that makes incomprehensible planning and decisions, as I'm going to highlight briefly. Let me comment on the overall government response. If I was a terrible human being, I would have called it government posturing. It is evident, Right Honorable Speaker, that government response focuses on ad hoc interventions in health and social protection, neglecting dividends that would arise from a comprehensive review of undertakings in other sectors such as education, infrastructure, taxation, security, decentralization, among others, Right Honorable Speaker. But given that the country is operating under pandemic cloud, it would be prudent to leverage opportunities arising from the new normal to enhance preventive and curative health interventions, as well as social protection. These have for long been neglected, and times have come for us to comprehend the consequences before us. While other sectors are important, the first call for any competent government would have been to augment the health sector so as to preserve life and livelihoods. Right Honorable Speaker, I'm emphasizing to preserve life and livelihoods. This should be visible in government responses. A responsive government, Right Honorable Speaker, and of course a competent one at that, would A, democratically engage Parliament in determining a logical, comprehensive, and legitimate national response plan. Parliament is consuming rumors, Right Honorable Speaker. B, consolidate savings made across sectors during the lockdown periods, such as workshops, travels, government sponsorships, international institutions, and capitation grants, among others, so as to channel them to critical response interventions in a national response plan, Right Honorable Speaker. C, target tax interventions, such as waivers on payee for essential workers, such as medical personnel and teachers, so as to increase their disposable income, rental tax to make accommodation affordable, and VAT adjustments, particularly on utilities, among others, as a means of sustaining livelihoods. D, halt implementation of new projects, such as the parish development model and allocations geared towards the implementation of a national response plan. E, negotiate with the external partners to deter non-critical projects and commitments so as to free government of Uganda funding towards pandemic management. And F, resuscitate decentralization through devolving powers, authority, and public funds from the central government, local governments, so as to ensure effective pandemic management in the communities, Right Honorable Speaker. Let me briefly comment on funding for the COVID resurgency. The Prime Minister disclosed to this Parliament, Right Honorable Speaker, that by March 2021, government had developed a resurgence plan, despite repeated calls for a costed plan, and the two are different. Government was adamant in laying it in Parliament so as to inform budgeting. Right Honorable Speaker, you are aware, and members, that when we were debating the current financial budget, we did implore government to be very clear on the key allocations to health targeting COVID, but it was general provision, not particularized provisions, Right Honorable Speaker. Parliament that holds powers over the purse is still unaware on the extent of the plan save for disclosed component of health, which is in the range of 1.32 trillion. The bulk of the allocations are towards the pillar of logistics, which consists of supplies, personal protective equipment, oxygen, patient care, among others. The rest of the pillars include surveillance, laboratory, case management, communication, among others. Right Honorable Speaker, it would have been helpful to disaggregate the allocations in each pillar so as to establish what has been prioritized. The House is questioning the priorities of government, Right Honorable Speaker. Aggregation raises risk of funding wasteful items.
No.
Yes, Madam
Can
Speaker.
you furnish the Prime Minister with your copy?
There's no
Copy of your response? She doesn't have a copy.
Unlike her, I saturated the copies, but I can.
No, she's
They're on the system.
just give it to her.
Thank you for indulgence, Right Honorable Speaker. I'm always available to help my sister in case of any gaps. Right Honorable Speaker and colleagues, I was saying that it would have been helpful to disaggregate government priorities to avoid wasteful expenditure. Remember, during the first COVID response, monies were allocated to advertising on billboards when people are under lockdown. So we had areas accruing to media houses because of misallocations. That should have been avoidable where allocations were transparent and shared. That Honorable Speaker, we generally can observe that focus of the resurgence plan is on curative rather than preventive services. This is deduced from the minimal allocation towards surveillance and vaccination, which are understood to be effective in deterring spread of COVID. For instance, Right Honorable Speaker, out of the 1.32 trillion, I only figure out 2.62 billion allocated towards vaccination. This is far short of the Ugandan shillings 1.4 trillion that was indicated in the National Development Vaccination Plan as estimated cost for a national rollout of vaccines, Right Honorable Speaker. The statement further indicates that for the period July to December 2021, shillings 372 billion was required to fund activities of the Ministry of Health. Unfortunately, this proposed allocation is not disaggregated. It is therefore difficult to appreciate what it is meant to do. Furthermore, Right Honorable Speaker, the statement is silent on whether the funds were included in the approved budget for financial year 2021-22 or not. In the event that the funds were not included within the approved budget, it would be prudent for the Committee on Health to scrutinize the whole resurgence plan and guide the House on the next course of action, Right Honorable Speaker. Though not comprehensively done, Right Honorable Speaker, we commend government for an attempt to reviewing the approved budget. It has communicated that the budget is going to be reviewed to suppress particular expenditures that are deemed nugatory in the circumstances. But the last time we checked, Right Honorable Speaker, the funds so far raised from the suppression only yield 600 billion, away from a target of 2.55 trillion. A review. So the funds are targeted towards the supplementary budget for COVID emergency, and a review of the supplementary, Right Honorable Speaker, indicates that health sector was to receive 206 billion out of the total of 600 billion. That's 34% or thereabout. Majority of the funds are towards the presidency, defense, police, and intelligence services, among others. Going by the recent past request for through supplementary, the funds are usually targeted towards routine activities that can be accommodated within the approved budgets, Right Honorable Speaker, which is why we are questioning what government is spending from the suppressed expenditures. In the interim, Right Honorable Speaker, before Parliament considers the resurgence plan, every additional penny mobilized should be geared towards vaccination and critical underfunded items in health. These are the game changers in normalizing citizen lives and the economy. We are aware, Right Honorable Speaker, that the government cannot handle COVID by simply allocating on this and that. Vaccination to us is the game changer. Commenting briefly, Right Honorable Speaker, on vaccination, the Prime Minister is right to be concerned. He's very right with the low vaccination rate of 4% of the initial target of 21.9 million eligible population. With this progress, Right Honorable Speaker, we can only cover the target population in 12 years, probably about 2033. This is largely attributed to over-relying on donor-driven COVAX facility and donations from countries such as Norway, India, China, among others. This measure approach, Right Honorable Speaker, of acquiring vaccines is alarming and shameful, to say the least. It is an indictment on the ability of government to guarantee lives of Ugandans during the pandemic, Right Honorable Speaker. Direct orders to manufacturers are almost negligible. Apart from an order placed to Serum Institute of India for AstraZeneca, it seems no other payment has been made. And remember, Right Honorable Speaker, that this was a total of 18.5 billion, and the government paid out to confirm the supplies. Instead of owning up its failure in making quick full payment in time, government is blaming in the Indian government for restricting vaccine exports. How come countries that had paid up were able to access their vaccines? Right Honorable Speaker. Nothing stopped the government from making payments to other manufacturers, as our neighbors Kenya did, and so other countries have did, through, to the private suppliers. The Prime Minister would love to inform Parliament that they were stopped from making orders from other suppliers. Instead, the government has just remitted funds recently through the cost-sharing framework of COVAX facility, as well as initiated legal requirements to procure Johnson & Johnson through Exim Bank and African Union. This is the signature tortoise emergency response of government, Right Honorable Speaker. And we hesitate to be part of that approach. Right Honorable Speaker, during the recent reading of the budget speech, 2021, it was highlighted that 560 billion Ghana shillings will be provided for purchase of vaccines. Unfortunately, this allocation is not traceable in the approved budget for 2021-2022. What is traceable is the fact that the Ministry of Health had indicated that in financial year 2021-22, it had a funding gap of 500 billion to purchase COVID vaccines. But in actual allocation, it's non-existent and non-traceable. With these contradictions, Right Honorable Speaker, it's difficult to determine with certainty whether funds have been committed or set aside for vaccine purchase, Right Honorable Speaker. We hear rumors in the corridors about possibilities. We want confirmation in quantities and dates, Right Honorable Speaker. Right Honorable Speaker, let me comment about, in general terms as I conclude, the critical prevailing deficiencies. For a while, Right Honorable Speaker, the country has been gripped with deficiencies in beds, oxygen cylinders, personal protective equipment, and ambulances. To the contrary, and avoid of reality, the Prime Minister reports that country has reasonable bed capacity to manage the pandemic. It is in her statement. Had the country had sufficient bed capacity, why would people go for home care as a priority, with all the risk attendant to home care? It is vital to note that just a month ago, the President made an undertaking that government was to install 300-bed field hospitals per regional hospital. We construed this to be a government assurance, Right Honorable Speaker. We wait for progress to date on this emergency, Right Honorable Speaker. The President also informed the nation of a roaming shortage of 22,800 cylinders of oxygen per day. While Global Fund intervened to install 7 oxygen plants in Kampala, Arua, and Hoima, Fort Portal, Mbarara, Lira, and Mbale hospitals, most of the facilities in Uganda continue to be constrained by insufficient oxygen supply. Unfortunately, the Prime Minister is silent on how many health facilities lack adequate oxygen supply and what interventions are to be taken to fill the gap. In the recent past, Right Honorable Speaker, when a funding gap of 1.4 trillion for procurement of oxygen cylinders in the 14 regional hospitals was presented, Parliament promptly made the funds available. This is an indication that critical affordable funding gaps can be filled without necessarily relying on external funding, and especially donors. Unfortunately, Right Honorable Speaker, it has been observed that health sector almost entirely relied on external funding for its development budget. In the just concluded financial year 2021 budget, out of the approved total development budget of 1.4 trillion, external funding accounts for 85%. The government of Uganda development funding was a paltry 2.5 billion. The country, Right Honorable Speaker, needs to reprioritize. The country has for years grappled with shortages of functional ambulances. This has been highlighted during the second wave. It is worrying, Right Honorable Speaker, to note that only 45% of health facilities in Uganda have an ambulance in singular. Majority of the ambulances are non-government ambulances. In the first wave, the Ministry of Health extended a request to members of parliament to volunteer their constituency ambulances to implement those to complement those of government. The citizenry also donated towards the purchase of ambulances. Instead of addressing ambulance shortage, cash donations from the population were used to procure 282 pickups. This is the misguided judgment and ill-guided expediency on the political leadership of a suffering nation, Right Honorable Speaker. The deficiencies in public health facilities, Right Honorable Speaker, in terms of beds, oxygen, and ambulances, among others, have been filled by private health facilities. This is attributed to the fact that government has been relegated to a regulator and fronting the private sector as the service provider. This has in effect escalated the cost of health care for the citizenry. In normal times, it had been realized that out-of-pocket per capita expenditure has risen from 41,000 Ugandan shillings in 2008-9 to now 62,000 in 1920. This is not affordable, Right Honorable Speaker, by majority of the citizens. To make matters worse, during this COVID pandemic, treatment costs have soared to over 3 million per day. Sadly, the Prime Minister falls short of articulating which interventions have been undertaken by government in collaboration with the private health facilities in making COVID treatment affordable. But she has made a general statement that is inconclusive and bears no direction. In a bid to save lives, Right Honorable Speaker, it is our considered view that government extends support to private health facilities in the form of incentives such as tax waivers on utilities, deployment of medical personnel, joint procurement of drugs, and the supply of oxygen. This should subsidize cost of medical care in private facilities. Right Honorable Speaker, I'm about to end my statement. Bear with me. Let me speak about decentralization of service delivery under COVID. Article 176, Right Honorable Speaker, of the Constitution of the Republic provides for a decentralization system of governance. It empowers local governments to plan, initiate, execute policies in respect of all matters affecting their jurisdictions. Right Honorable Speaker and members, whereas local governments exist, the central government has for a long adopted a divergent decentralized system in intent and stature. Local governments have been robbed of their constitutional development functions, powers, and responsibilities. This has largely been actualized through budget allocations. For instance, Right Honorable Speaker, in the supplementary budget funding for COVID for financial year 2021-2022, local governments were allocated only 52.8 billion out of a total of 600 billion. This translates to only 8%. Furthermore, Right Honorable Speaker, Kampala City, the epicenter of the second wave, was not allocated any supplementary allocation. Kampala, the epicenter, no supplementary for it. For the local governments that were considered, each received less than 800 million. Yet Office of the President was granted supplementary allocation of 6.9 billion. So based on the supplementary allocation, right, Honorable Speaker, the epicenter of COVID-19 is Office of the President, and it deserves better consideration than local governments. Right, Honorable Speaker and members, the relegation of local governments has been exemplified in the management of the COVID pandemic. Local governments must plead and wait for supplies of vaccines, ambulances, drugs, and PPEs from the central government. Decentralization of developed functions is unconstitutional and the main cause of the lukewarm COVID response of local governments. Right, Honorable Speaker, of late, resident district commissioners, RDCs, with the support of security forces, have, in contravention of Article 183, 1A of the Constitution, been positioned to be the de facto political heads of local governments in the response to COVID. Their actions are unconstitutional and out of violence to the law, right, Honorable Speaker. This has led to unlawful institution of COVID response meetings. So, RDCs can stop local government from convening to deliberate on their constitutional obligations towards their citizens because the center has recalled their powers unconstitutionally, right, Honorable Speaker. This has led to, so no wonder all local governments are ill-prepared to manage the pandemic. In a bid to facilitate local governments, right, Honorable Speaker, in managing the pandemic, Parliament should with immediate effect be informed of the COVID response funding gaps in the country. They should expeditiously be scrutinized by the appointed committee of Parliament and the House guide on recommended course of action. Let me comment on the pet project spearheaded by the Right Honorable Prime Minister. That is the support to indigents called the Honorable Nabanja Fund, Right Honorable Speaker. Whatever it is quite unfortunate that focus on COVID response is being reduced to only 100,000 shillings as a cash transfer to the vulnerable workers. The cash assistance has been derived from a proposed minimum expenditure food basket, which includes posho, beans, soap, and cooking oil. One wonders whether the food basket is equivalent to the recommended balanced diet, nutrients, or calories that a person requires to sustain life and boost immunity against COVID. Whereas the cash relief gesture is welcome, right, Honorable Speaker, its implementation is pretty much discriminative. And I heard the Prime Minister trying to justify discrimination. Last year, the Uganda Bureau of Statistics established that Uganda has 5.11 million vulnerable workers. Unfortunately, the same institution, I think, has been pressured to consent and facilitate registration of only 501,107 vulnerable workers. This means that 90% of the vulnerable workers are excluded from the relief intervention, even with vivid statistics available to the Prime Minister and her government to respond. These are reservations regarding the criteria that the interventions, the National COVID-19 Task Force used to identify the 13 categories that she mentioned earlier. Irrespective of the criteria, most workers or individuals are not registered in a centralized place, nor regulated under associations that would act as centers of enrollment and verification of beneficiaries. Many are outside the realm of trade licenses that would require them to be captured in the records of town clerks, as was guided by the task force leaders chaired by the Prime Minister. The categorization is conveniently selective. For instance, Right Honorable Speaker, the shop attendants in the closed arcades are not included. They earn a daily living. Of late, market traders raised concern that even though they were allowed to operate, majority of the customers cannot reach their stalls due to traffic restrictions and lack of earnings. They are not different from categories that have been considered, such as car washers, who wash few cars, border riders, whose returns from cargo transportation are far less than the proceeds from passengers, musicians and comedians who earn minimal commission from online platforms. Justification for inclusion of these was premised on their earnings being substantially reduced during the lockdown. This therefore raises issues of fairness in categorization of beneficiaries. Right, Honourable Speaker, outcries have also been heard from university students who were unable to return to their homes due to the inflated transport costs and limited days of travel. These too are vulnerable, but have been excluded from vulnerable persons. The minister responsible for gender did indicate that such vulnerable persons who are not workers will be catered for later without any commitment to a time frame. Therefore, the categorization of vulnerable beneficiaries as agreed by Cabinet promotes exclusion and entrenches inequalities. It also exposes the vulnerability persons such as the terminally ill that depend on support from workers to the risk of death. Apart from food, Right Honourable Speaker, the cash relief did not consider other costs of daily living, such as rent, water, electricity, and medical care. These costs ought to have been incorporated in the computation of the cash transfer amount. How would one cook the food without water or energy? Where will they cook and eat from when evicted from their homes because of rent? These are COVID patients in some households. Will they be treated on the 100,000? Yet hospitals are charging medical fees up to 3 million daily, and we know the thin spread of government facilities throughout the country, Right Honourable Speaker. The beneficiaries, Right Honourable Speaker, of the households are expected to have MTN or Airtel mobile money lines, as well as the national identification number, NIN. It was indicated that one may access the cash relief with just a NIN at a mobile post bank van. The distribution mechanism raises a transparency concern, for no competitive procurement process was undertaken to award the contract to Post Bank and telecom companies. So how was this chosen? And how is this reached to be able to be the one to deliver relief to citizens, Right Honourable Speaker? More still, Right Honourable Speaker, the registration process of beneficiaries was hijacked by regime apologists, particularly RDCs, in disregard of local leaders. These are firms that government only appreciates the role of local leaders when they're involved in general elections. Therefore, Right Honourable Speaker, in such exercises, they are deemed to be competent and among the lead stakeholders, but not in identifying vulnerable persons that they lead daily. Consequently, the beneficiary enrollment process has been flawed, exposed to manipulation for patronage and political gains. This is not news, for it has been evident in relief enrollment of musicians, promoters, bouncers, ghetto youth during and after the election period. It is our considered opinion, Right Honourable Speaker, that every vulnerable person is considered for the cash relief and derivation widened to incorporate utilities, rent, minimum medical care package for the citizens. Irrespective of continuance of the lockdown, Right Honourable Speaker, community-based models that are hinged on the local council system should be used to record, maintain, update registers of vulnerable within their respective communities. This would reduce response time in future lockdowns or if a disaster befalls an area. The registration of vulnerable people should not be an emergency. They should be in existence for a record to be called whenever required, Right Honourable Speaker. Right Honourable Speaker, it's worth noting that there are some vulnerable persons who would not be categorized as so if they were able to access benefits that are accrued to them. In this regard, the President is urged to assent to the NSS bill so that savers access their mid-term payments. This would lessen the economic impact of COVID in the eligible households of the 1.5 million members of NSSF. There's no point for the contributors to die of hunger and stress, only for the dependents to access and enjoy their savings. Otherwise, one wonders why NSSF would entirely transfer the burden of assisting these contributors to government that seeks to exploit their contributions. We believe that the Prime Minister probably in her response would inform the country why the President has not up to now assented to a bill that was passed by the 10th Parliament, Right Honorable Speaker. Right Honorable Speaker, let me comment as my last comment on accountability of past COVID interventions. Since financial year 2019-2020, several interventions have been funded in response to COVID-19, Right Honorable Speaker. Regrettably, a lot of it has been wolfed through systematic corruption tendencies of government. Unfortunately, the Prime Minister was silent on the vice and the risk it poses in the second wave COVID response. In 2020, Right Honorable Speaker, the Budget Monitoring and Accountability Unit reported that verified deliveries are fewer than what was paid for. For instance, Joint Medical Stores delivered 1,000 beds, but the monitoring team was only able to verify only 331 beds. In other instances, it was noted that MS Silverback Pharmacy was fully paid before making deliveries that were costed and inflated. The company was contracted to provide 2 oxygen plants and 450 cylinders at Ugandan shillings for 6.4 billion. Yet earlier, the same cost delivered oxygen plants in 13 regional referral hospitals. Whatever changed in a very short time, probably the Prime Minister or the Minister of Health at an opportune moment should be able to explain to the country the sudden change of costing for these facilities. Separately, Right Honorable Speaker, the Auditor General, in his recent report of 2021 February, noted that flouting of procurement regulations, mismanagement of quarantine centers, mismanagement of cash donations, ghost receipts of in-kind donations, and mischarges, among others, were problematic as accounting gaps. Based on the above, Right Honorable Speaker, the public generally concerned and very suspicious that government will continue to prey on public funds, borrowing a leaf from one of the recent transparency conditions for accessing International Monetary Fund loans. All details of contracts of COVID procurement should be published on the website of the Ministry of Finance, Planning and Economic Development. Publish lists of procurement detailing winning bidders of contracts of any monies above 500 million for works, as well as above 200 million for goods and services. The list detail items procured, method of procurement, service provider, the shareholders, contract value, status of procurement, source of funding, among others, Right Honorable Speaker. These would give confidence in the citizens that there is a government that cares and is accountable. Right Honorable Speaker, the Prime Minister rightly observed that globally, there is no perfect system, and I want to agree with her statement. But unfortunately, Uganda does not subscribe to a global system. They subscribe their taxes to a government of Uganda, and that government should respond without referring us to other jurisdictions. Because if you compared with what other governments have done, the Prime Minister will throw in the towel tomorrow, Right Honorable Speaker. I want to thank you, Right Honorable Speaker, and members for listening to our view and the considered approach to this problem, Right Honorable Speaker, as a response to the government's current wobbly position. I thank you, Right Honorable Speaker. I beg to submit.
Thank you so much, Locke. We've had a response from Locke. And since what is being drilled on is mostly on health. Before we go to a debate, I really want to hear from the Minister of Health on what is happening. And when you're discussing, I want you to bring in the issue of ambulances, how far you've gone with ambulances in all the districts. Then two, the allowances for health workers, whether it has been sent to those people. Three, whether the purchase of the 280 pickups is not a mischarge. And then what plans you have for vaccine? Because the only solution we have for COVID-19 is purely vaccine. And I also have a petition in my office from students, internal and international students, who did not travel back to their homes after the closure. Prime Minister, we need to see what to do with those students. Honorable Minister of Health, we want to hear from you before we put the debate.
Right, Honorable Speaker and honorable members, allow me to thank you for this opportunity for me to respond to a few issues. I'll start by appreciating the Right Honorable Prime Minister, who has clearly given answers to most of these issues in her statement. And clarified on many of the issues that are being brought to light. Right Honorable Speaker, I have listened very attentively
Honorable Sewongo, members want to debate on this thing. You're only raising an order because a leader of opposition was not appreciated. I mean, we are teaching these young people bad manners. Huh? I know. Okay. Right on, Loeb, thank you for your report. So use it. It was a very exhaustive report. Thank you.
Right Honorable Speaker, allow me first of all to start by highlighting a few issues that came up in the report of the leader of opposition. On the resurgency plan, Right Honorable Prime Minister, apart from the Parliamentary Task Force on COVID-19 that requested me for a response plan, I have never received a letter requesting for the response plan. And in any case, the leader of opposition makes mention that the Ministry of Health indicated the total cost of the response plan in the budget. Right, Honorable Speaker, how would I have come up with that figure if there was no response plan and it was not disaggregated? I want to assume that the leader of opposition meant a holistic response plan covering all sectors. And in that case, we can bring a response plan that covers the entire country, but it will not be from the Ministry of Health. The response plan definitely prioritizes logistics because we require that for management of patients. But that does not mean that government has not catered for prevention. Right, Honorable Speaker, we have made all efforts to secure vaccines. Vaccines are not available on the market. The global demand outweighs the production. And many of the rich countries have paid for many months to come. It is therefore difficult for many African countries to secure vaccines. And that is why the Right Honorable Prime Minister in her statement said, government is making a multi-pronged approach, including direct procurement from the manufacturers and all available sources like the COVAX facility and the African Union. Right Honorable Speaker, it is true that government allocated 560 billion for vaccines. To date, 101 billion has been provided. We have so far only managed to pay 3 billion to the African Union that communicated that they will be able to release 2 million doses of the Johnson & Johnson vaccine to us. We have not paid to any other supplier because the vaccines are not available. In the Right Honorable Prime Minister's statement, she indicated that vaccination is a priority, and government resolved that it is a priority so that we can open up the economy. Government is making all efforts to secure vaccines, including tasking our missions abroad to work with the manufacturers and identify available sources so that we can pay for the vaccines. Right Honorable Speaker, you have requested to know whether the 282 vehicles was not a mistake. I want to state here very clearly.
It's not a mistake per se. A mischarge is an accounting word.
A mischarge.
A mischarge, not a mistake.
Right Honorable Speaker, the funds to procure these vehicles was a call by His Excellency the President. The money was received by the fund task force that was appointed, banked in the fund account that was opened and transferred to the consolidated fund. And it was only after the committee chaired by His Excellency sat that funds were allocated to the various components that were read by the Right Honorable Prime Minister. Right Honorable Speaker, from the beginning of the pandemic, the World Health Organization was hiring 200 vehicles to support the districts for surveillance, for transporting samples to Kampala, and for other activities. It was extremely prudent that pickups are procured to facilitate districts carry out surveillance. Ambulances are not used for surveillance, and ambulances cannot transport samples. So the pickups were not a mischarge, and the districts will definitely appreciate the pickups. Right Honorable Speaker, in the first supplementary that was allocated to Ministry of Health, funding was provided for 30 ambulances, in addition to the existing ambulances. These were procured, including 3 boat ambulances, and deployed as per the Emergency Medical Services Policy and Strategy. Allow me to inform this august House, Right Honorable Speaker, that ambulances are not deployed per district, and neither are they deployed per facility. According to the policy, ambulances are deployed per region and managed through the regional referral hospitals. And currently, there is a network of ambulances that are ferrying patients from facility to facility and to the center. Right Honorable Speaker, you also mentioned about health workers. Allow me to inform you, Right Honorable Speaker, that allowances are paid to health workers who are taking care of patients in the isolation facilities. In addition, there are also surveillance officers and laboratory officers. All these health workers have been paid their contract sums of salaries and allowances. But this is a continuous issue. It does not end because the allowances are paid per day. And government will continue to pay as the pandemic evolves. Right, Honorable Speaker, on the issue of international students, you have allocated that to the rightful ministry and to the Prime Minister. I thank you for giving me the opportunity.
Thank you, Minister of Health. Minister, just for information, it's
Clarification,
not
Madam
that we
Speaker.
are blaming government, but I want you to appreciate one thing. In every district we have, Works has a vehicle, Health has a vehicle, a pickup, RDC's office has a pickup, CAO's office has a pickup, then LOC5 has a pickup. Wouldn't those vehicles be used for surveillance?
Clarification, Madam
Wouldn't
Speaker.
we use the vehicles, the money we are spending on buying the pickups on other things? Just a food for thought for you.
Clarification, Madam
Uh,
Speaker here.
Honorable Nabanja, do you have anything to say before we put a debate?
She will respond.
Honorable Nabanja,
Clarification,
kindly
Madam
take note
Speaker.
of the questions.
Clarification.
Members,
Clarification, Madam Speaker.
members, I am putting the report to debate.
Clarification
I
here.
don't want issues of clarifications. If you're coming, come and debate on the report.
I'm here then, Madam Speaker. My name is Baka. Baka Stephen, Bukoli County North.
Yo,
Baka Stephen, Bukoli County North. This
unfortunately,
side,
I
Madam
don't see
Speaker,
people.
this
Okay.
side.
Yes, Stephen.
Right, Honorable Speaker, my name is Baka Stephen, Bukoli County North, Bujiri District. Madam Speaker, I wish to thank the Prime Minister and the Leader of Opposition for a statement well made. The Leader of the Opposition's statement was very elaborate, as if it were a response to the State of the Nation address, but all the same, thank you very much. Now, Madam Speaker, I rise on the issue of beneficiaries. At what point did we agree as the government or as the parliament that vulnerable people, the borders, you told the people, those of saloon operators and the massage parlors are only found in the towns of the level of a city and municipality, to the extent that only beneficiaries from cities and municipalities were recorded. Right, Honorable Speaker, by only selecting cities and municipalities, they left out the deserving vulnerable people from town councils and small towns of this country. So therefore, I wish the Prime Minister to come and tell us what happened, how did they agree at such a level to agree that only municipalities and the cities would benefit. I want the minister, the Prime Minister, to agree that it was a mistake, go back, look for money, such that our people in the villages can
other members
benefit.
sit as one is making a submission?
Such that our people can benefit across the country.
Can
And in
other
this-
members first sit?
And in this, right, Honorable Speaker, the Prime Minister should not set.
Can other members first sit as Stephen finishes his submission? Dr. Pear, can you sit?
Thank you, Right Honorable. Right Honorable, as I wind up, I request the Prime Minister and her team to go back and consider all deserving beneficiaries who are across the country other than in municipalities and cities, such that they get the money. And in this, I should not hear, the House should not hear the statement that there is no money. There is money, Right Honorable Speaker, because I heard a rumor that they have started the budget cuts starting with the Parliament. And this matter should be brought for debate because these budget cuts should not be localized to Parliament only. They should be across government, starting with State House, down to the municipalities, to the local governments, across government, such that we have enough money, our people should benefit, and also revamp the health sector, which is limping, as we shall hear from the report of the ad hoc committee. I thank you very much, Madam Speaker.
Honorable Sarah,
Madam Speaker, in addition,
Sarah Opendi.
Thank you. Thank you, Right Honorable Speaker. Right Honorable Speaker, I want to thank the Prime Minister and the Leader of Opposition for their statement.
Members, I'm giving you only 2 minutes each. Everybody wants to debate.
Right Honorable Speaker, one of the issues that I wanted to raise was on the town councils. While we are talking about town councils, there are those new town councils that have just been created. But there are town councils that have existed for a very long time. For instance, if I look at Malaba Town Council, Right Honorable Speaker, you have been there. This town council, most of the people survive through cross-border trade, and their businesses have been affected because the border has actually been closed since the last lockdown in 2020. We have raised the issue here of the small gate. The Malaba Town Council that you knew is actually a ghost town, and most of the people do not have any means of livelihood now. It was quite disappointing for my government to actually exclude such town councils, the old ones that have been in existence. I pray that despite the closure of this little token that government was giving, it should still consider these old town councils where people's livelihood. I want to close, Right Honorable Speaker, by also raising the issue. We are talking about lack of vaccines, but Right Honorable Speaker, while it is true that we don't have adequate vaccines from the suppliers, we have our own people here in country who have come up with supportive treatments like Professor Gwang, Right Honorable Speaker. We all have been reading what has been happening. The National Drug Authority, Right Honorable Speaker, cleared Professor Gwang's Covidex as a supportive treatment. And this gentleman has been requesting government to support him with the clinical trials, but also most importantly, mass production, since this vaccine, this Covidex is not harmful to human health. I want to know from my government what support it is giving to Professor Gwang. But also most importantly, we all know that we passed the Indigenous and Complementary Medicines Bill, which is now an act. We need to promote our own herbal medicines and not wait for the vaccines that we even don't know whether they are effective enough in dealing with these new variants, Right Honorable Speaker. Lastly, Right Honorable Speaker, I also want to know from the Right Honorable Prime Minister, we cannot wait for free vaccines. Why can't we accredit a few facilities so that those who can afford can get other varieties of vaccines from the private, not-for-profit hospitals or private for-profit? Thank you,
Members, the issue of Professor Gwang, maybe just for information, I'd given one of the commissioners to deliver. Professor Gwang has donated us 500 doses for the house. And in appreciation of what government has helped him in.
Madam Speaker.
Brenda, Nabukenya Brenda, you see, when you remain standing, I am not going to choose you. Nabukenya Brenda, this is not a market. Nabukenya Brenda.
Thank you, Right Honorable Speaker, for the opportunity. Right Honorable Speaker, I stand to comment on the Prime Minister's report in regards to the education sector. I have listened, Right Honorable Speaker, and waited to hear statistics, issues concerning continuity of education, but that were lacking. Right Honorable Speaker, in the last lockdown, the Minister of Education proposed a plan for preparedness and response in regards to COVID and emergencies in school. They went ahead and printed materials, self-study materials for learners from secondary school and primary schools, and also broadcasted lessons on radios. Right, Honorable Speaker, I would appreciate that. But in this second lockdown, the ministry has been silent. I got an opportunity to look through the self-study materials, and I realized that each material was for first term for each and every class and every year. What if we are in second term? Are students in villages learning? Because due to the digital divide, rural areas cannot access technology. That means virtual learning cannot be effected in rural areas. Right Honorable Speaker, the silence from the Minister of Education is appalling. Ugandans want to know what is happening. Our learners in rural areas actually learning? We have an idea. I think this plan was brought in place with the notion that no one is left. Right Honorable Speaker, 1 minute to conclude. We want to know from the ministry what is happening, and also on the teacher welfare. Right Honorable Speaker, the welfare of teachers is priority because it has a multiplier effect on retention and the quality of education in schools.
Procedure.
Right Honorable Speaker, the president gave a directive that 20 billions be allotted to private teachers through a scheme. The Prime Minister has not mentioned anything in that area. This country is going to be affected in the future if the welfare of the teachers is not prioritized. Right, Honorable Speaker, we have sportsmen. This sector has been in lockdown for 2 years. The footballers are not in games. Even all those who participate in games and sports. I didn't hear the Prime Minister include them into those who are supposed to benefit. I think the criteria used to determine who is a target group, who is a vulnerable poor, is not accurate. It's very poor.
Honorable Batua.
Yeah, thank you very much, Right Honorable Speaker. My name is Batua Timothy Rusala, Member of Parliament, Jinja West constituency. Right Honorable Speaker, allow me address you as the Shadow Minister of Health. First and foremost, I appreciate the speech made by the Honorable Leader of Opposition, very informative. And I want to assert and also affirm that lockdown doesn't cure COVID, and neither does it make the disease disappear. All that the lockdown does is to enable government buy time such that it can mitigate the disease. Right Honorable Speaker, allow my office put it to your attention that as of now, there is no exit strategy that is visible to us and even the public for this particular lockdown of the 42 days. We seem to be in an indefinite lockdown. In the first wave, COVID-19 was a disease that was visiting upon us. It's at the points of entry that whoever was coming in was getting tested And that approach was right. This time round, due to the laxity and the failure of the systems that were put in place, COVID-19 found its way in each and every village, in each and Right Honorable Speaker, grant me sometimes, since I'm speaking as the leader, as the shadow Minister of Health. Yeah, and the other one also spoke until she completed that speech. So, Right Honorable, in a situation like this, we hope to see mass testing. Where it's not possible, at least we hope to see a scaled up testing mechanism, at least for the high volume areas. The people working in Chikubo, the people working in various malls. It is in this lockdown, in these last 2 weeks of the lockdown, that we would see effort of the government. Right Honorable Speaker. Speak.
Honorable Bigirwa Nora. And as the Bigirwa comes, I want to recognize the arrival of Her Excellency, the Vice President of Uganda. Madam, you're welcome. Noeline Kisembo. Kawalia. Honorable Kawalia.
Thank you, Madam Speaker. All honorable members of Parliament. I'm Kawalia Abubakar, MP Rubaga North, as well as the Shadow Minister for Kampala and Metropolitan Affairs. Madam Speaker, let me start by appreciating the report of the Honorable Leader of Opposition. And actually, at the same time, I'm also going to appreciate the Honorable Prime Minister, though we expected a lot of issues in her report that we've not heard about. I don't know, Madam Speaker, if the Prime Minister is aware about the exorbitant charges from Ugandans, most especially those ones coming from abroad, when they reach at the Entebbe International Airport. People have been charged with a lot sums of money, but I have not had any government official talking about that. We are here to receive the communication from the relevant minister. Madam Speaker, since this is my maiden speech, I request you to give me 2 more minutes. Madam Speaker, Kampala being the epicenter of COVID-19, we have had a lot of challenges. And one of them is the brutality that has been raided or ordered by the RCC of Kampala. I don't know whether the office of the Prime Minister is aware on the way how the RCC of Kampala beats up our people by using guns without allowing them to access their places of work, most especially those ones who work in markets. And Kampala being the business center of this country, most of our people get what to eat by accessing markets like St. Valley Kudembe and others. But we have seen the RCC of Kampala negligently ordering brutality to our citizens, and we also expected such a communication from the report of the Prime Minister. Madam Speaker, there's another issue of ambulances. I have heard the Minister of Health speaking about the issue of ambulances, but it's quite humiliating that the capital city of this country, at the moment at City Hall, manages only 3 ambulances. Yet, Kampala has a population of Ugandans who reside within the boundaries of Kampala that totals to 1.7 million people. So we are yet to hear from the Ministry of Health why they have failed to allocate a budget to Kampala, because our predecessors in the 10th Parliament had allocated 2 billion in the. Currently, we've not had them commit themselves on how much money they are allocating to Kampala as far as the.
Honorable Apea. Dr. Apea.
Madam Speaker, thank you for giving me the opportunity. I would also like to appreciate the statement made by our Prime Minister, which has highlighted great efforts that government has put in place to address this scourge. Madam Speaker, I'm here to make a comment on two issues. One, on the issue of vaccination. Our honorable leader of opposition made a statement that could alarm the whole country, that at 4% vaccination rate in the country, it means it will take 12 years. But I would like to inform our honorable leader of opposition that data from the World Research on COVID is showing right now, just 2 minutes ago when I checked, that even India, which is producing the vaccine, has just vaccinated 6.3%. And the average vaccination at the moment in the low-income countries is just 1.1%. I would like, therefore, to request that when we give statements, we shouldn't give statements that alarm the country. That in the whole East Africa, Uganda at 4% is actually doing very well. Kenya has just vaccinated 1.1% and Rwanda 2%. So I would like to really thank our government for doing all that it can to make sure that the vaccination program is implemented as scheduled. The second issue, Right Honorable Prime Minister, is the issue of funding the pandemic. In the same response from the leader of opposition, highlighted the issue of the emergency funding that the Right Prime Minister highlighted, the 372.8 billion, as well as the resurgence plan of 1.3 trillion. I carefully read that report and analyzed and recognized that yes, there is only a budget of 2.6 billion for vaccination, but that does not mean that the government has not prioritized. My analysis of that report meant that that budget is as little because there's already allocation for vaccination. And that is why we saw that budget. And on that note, therefore, the emergency plan, in my view, and in that report, would really be able to address the issue of home-based care and community response that has proven to work in our country. I would also like to reiterate the report, the presentation of our Honorable Prime Minister of Health on the issue of ambulances being allocated to regional hospitals. The issue of the boat ambulances. I would like to know from the Minister of Health that there are districts like Amolatar, which is a peninsula, covered by Lake Kyoga and Lake Kwania. Could it be possible enough that such districts and island districts are considered, irrespective of your health policy, of allocating ambulances only to referral hospitals? As we talk now, my district, 60% of the district is cut off by water. For you to access another community, you need a boat to go there. Meaning that if anybody falls sick in those communities, There is no way for them to access these medical services. Finally, right from
Minister of Health, that myth of saying that the ambulances should be at regional level is far-fetched. We should have ambulances at district level. What was the essence of you? What was the essence of having district hospitals? Honorable Minister, I'm talking to you. Yes, we need ambulances at district level. Honorable Akelo Lucy. Honorable Akelo Lucy is on Zoom. Lucy?
Hello, Right Honorable, I don't know if you can hear me.
Yes, I can hear you, Lucy.
Yeah, thank you so much for giving me this opportunity. Allow me to also convey my congratulatory message to you, this being my maiden speech, and also to thank all the members and congratulate them. Madam Speaker, following the report of the Prime Minister, I have 3 points to make. One is in regards to the travel permits that have been given. I heard at one point that borders were allowed to carry patients. Madam Speaker, I want to bring to your attention the fact that many of our medical workers actually don't have vehicles. The assumption that the Office of the Prime Minister and the National Task Force had in mind is that all the medical workers actually had vehicles. Madam Speaker, I have been getting my treatment from Mulago, and recently when I went there, one of the doctors actually asked me to passionately ask the Prime Minister to consider the health workers who are not allowed to use borders and yet don't have vehicles. These medical workers are forced to stay home because they cannot walk to their health facilities. Two, Madam Speaker, in regards to the facilitation or the relief being given out, I want to add my voice to what Honorable Sarah Opendi said about the border districts, the border town councils. Madam Speaker, my district, Amur, is one of those that is grossly affected. Many of my women who are having markets at the border cannot get money because the potential customers who cross over from South Sudan are not there. So these people, these categories of people actually must be considered. Finally, Madam Speaker, in regards to what the leader of opposition said as to the assent to the NSSF bill, I also want to bring the House and the whole country to the fact that as a parliament, in the 10th parliament, we did pass the National Health Insurance Bill. I was just wondering and asking Madam Prime Minister and our Minister of Health how far this bill has gone and whether this wouldn't be actually a solution to the high prices that the Ugandans are paying in regards to the treatment of COVID-19. Madam Speaker, thank you so much for giving me this opportunity to air my voice virtually, and may God bless you.
Thank you, Lucy. Can we have Wilson Kajwenge?
Thank you, Right Honorable Speaker, and I congratulate you, this being my first time to address this August House. I raise to support the statement given by Right Honorable the Prime Minister. Under the circumstances, your team has done well. I only encourage that you do much better. Right Honorable Speaker, I acknowledge and I'm very happy that the 42 days announced by the President, we have noted significant drop in the rate of hospitalization in the past 2 weeks, as the report said. This is good, and I encourage the frontline people to move forward. Madam Speaker, I wish to mention that whatever has been raised is as important as protecting our frontline workers. In this, I mean providing them with personal protective gear. Their life is as important as provision of oxygen or installation of cryodyne or liquid gas or molecular oxygen. We must, in my view, Right Honorable Speaker, and Right Honorable Prime Minister and the Minister of Health, provide our frontline workers, our health officials with sufficient protective gear. Must be budgeted for and provided for as soon as possible. I am speaking because I have just been with my district task force of Chiruhura, and I met the doctors of Chiruhura Health Center. Only my colleagues, members of parliament of the district, and I had to donate because they did not have sufficient PPEs. I'm happy that the Right Honorable Prime Minister and her team are installing liquid cryogenic plants whose purity. This is very important. I'm also happy that they are procuring cars for delivering it on time these liquid to regional hospitals. My concern, however, is that we need to cut the red tape. They need to be done as yesterday. This is a war we are fighting, and we must not allow bureaucrats to dictate. Madam Right Honorable Speaker, I wish to thank the Prime Minister and her team for having met the team from private hospitals. This, and addressing the embarrassingly extortionate and exorbitant hospital charges levied by private health facilities. Our people are crying even today. I want to encourage the Prime Minister and call upon the Prime Minister and Cabinet to continue engaging with them, to provide them with what they need, because our public health care system cannot handle the whole population. We must support these people, but make sure they do not be extortionate in charging our people. I want to applaud a proactive decision of directly purchasing vaccines from COVAX facility through African Union and open market. Madam Speaker, Right Honorable Speaker, this is extremely very important. We should support the Prime Minister and her team to make sure this is done as of yesterday. I end by calling for fast-tracking and negating bureaucracy in implementing these robust decisions that we have to. I also congratulate the Right Honorable Prime Minister for having rejected substandard mosquito and blank in Kasese. So all people, our people should not take advantage of this, to provide substandard equipment to people who are. Just as I conclude, Madam Right Honorable Speaker, the issue of selecting vulnerable people, my constituency, Nyabushozi, is as vulnerable. They're actually not looking for 100,000. They're actually looking for vaccines, not for COVID, but also for their sick animals through foot and mouth disease. That renders them vulnerable. I am happy that ministers are in the field concerning ministers, and I hope that will be so. Right.
Members, we have only 30 minutes to finish the debate.
Yes, Madam Speaker.
Honorable Seungu. There is somebody behind there, the lady behind.
Musila John. Right Honorable Speaker Musila John.
Madam Speaker, Chuan Kabdala.
Thank you, Honorable Speaker.
Madam Speaker, is it me?
Honorable Speaker, I'm lucky that I've followed the honorable member from Chiruhura.
Members, you're all going to debate, even if it means finishing at 10.
And that's very interesting hearing a member from Chiruhura crying about vulnerability, yet it's the home of the president. That's very interesting. But Madam Speaker, I want to thank the Prime Minister and the leader of opposition for the statements they have given to us. And this is not about to thanking, but it's decorum of Parliament. So we don't just thank one or the other side for the sake of what someone has said.
Point of order.
Right,
Honorable
Speaker.
Order. Order, Right Honorable Speaker.
Yes. Order.
I'm putting Honorable Seung to order. It's just insinuated that people from the president's district are not supposed to cry of being vulnerable. Is it in order, Right Honorable Speaker, to insinuate that people from the president's district are more privileged, yet they're also suffering like any other? Is he in order?
Members, I don't know why you're dragging the name of the president in this debate. Can we stop dragging the name of the president in the debate? Debate on the issues that have been raised, and we look for solutions.
Yeah, Honorable Speaker, people must be very attentive when we are talking. Sometimes they don't comprehend what we say properly. So let us see the honorable member. Honorable Speaker, I want through you to the Prime Minister. The issue of private school teachers is not a settled matter. And I want to say, Madam Prime Minister, unless you provide evidence to this Parliament, teachers in private schools have not benefited anything as per your statement. The 2 minutes, Madam Speaker. Even the 20 billion that was given to private school teachers has not taken course. When Mingo is around, he can testify. Honorable Speaker, the question here to the Minister of Health is, where is the 18 billion? We gave them as a supplementary and financially raised it, and they are supposed to procure 2.5 million doses, and they have never been brought to the country. I want to thank the leader of opposition. That's the area he has handled very well, but the minister is fearing because we are giving facts. Madam Speaker, while in the committee meeting the Minister of Health, she told us that they had given UNICEF 40 billion to procure vaccines for this country. And she's saying this on this floor of Parliament, that they have not procured anything, they have not given out anybody to give us, sell to us vaccines. Who is telling lies in front of this house? The issue here, Madam Speaker, is vaccinating Ugandans. Whether you were born, you will not die of bullets or any pandemic, but Ugandans must be vaccinated. And the money we have given to Ministry of Health is worth 6 trillion. Information? Come.
Thank you for giving me way to provide you with this information. Madam Speaker, the information I wanted to give Honorable Seungu regards to almost a neglected sector. That is the business sector. In your communication, Prime Minister, you neglected to say anything about the business
Can you
sector.
put on your mask?
Thank you for caring over my life. We did not hear any economic interventions being mentioned in the statement by the Prime Minister. The business community in Kampala is suffering. The interest rates are not going down. We don't know how they are going to handle the rent areas after the 42 days. Previously, the government came out very clearly and issued statements over the same, giving orders to commercial banks on how to handle these businessmen and their loans, and the landlords on how to handle the rent areas. So the information I was giving to you is that as we care for the private teachers, you must get information that even the business community is also suffering the same over being neglected by the current government of Mr. Yoweri Kaguta Museveni and Madam Nabanja. I thank you.
So, as I conclude.
Madam, you gave out his time. Honorable Sewungu, you gave out your time. Yes?
Thank you very much, Madam Speaker. First, I would want to thank the PM for that report that she has presented to us. Clearly, government is trying to do whatever it can do for its people.
Honorable Polosi, mention your name for the answer.
My name is Akampulira Prosimbabazi. Thank you very much, Madam Speaker. Clearly, government is trying to do whatever it can do to help its people. But we cannot all appreciate, that is clear. The leader of opposition has brought out what maybe they think we can do. But we want to request you, as the leader of opposition, to also go out to our people and tell them the truth, that this COVID is for all of us, that we need to work with government no matter what. There is no opposition in COVID-19. It is for all of us, and it will get all of us. Therefore, I would want to thank the Prime Minister for that report, but I also want to request government. Let us give opportunity to those who can get vaccines and buy in private hospitals. Because for me, I'm a young mother who is still giving birth. Up to now, we got hospitals and there are vaccines that they will tell us to buy, and we can buy them for those who want. Therefore, I would want to request you that if there are hospitals that can afford to buy these vaccines and vaccinate the people.
Order. Thank you. Right Honorable Speaker, my colleague, the way he's talking is as if our lovely leader of opposition does not care for Ugandans. The way he's insinuating, as if the leader of opposition is against everything the government is doing. Right Honorable Speaker, the leader of opposition was very clear, and he was giving the best directives that the government should put in place in the fight against COVID-19. Right Honorable Speaker, is the honorable member in order to insinuate, as the commissioner moreover, to insinuate that the right honorable leader of opposition does not care for the people of this country? Is he in order?
Honorable member, the commissioner is just emphasizing that COVID-19 does not know parties.
Thank you very much, Right Honorable Speaker. And Honorable, I didn't mean that the Right Honorable is not considering. I didn't mean what you said. Maybe you didn't understand me clearly. All I meant is that COVID is for all of us, and we need to work together. Whether government or opposition, it is for all of us. And that is clear. Therefore, for me, my request is that government authorizes private hospitals to get these vaccines, let the rich pay for the vaccines, and let government go and vaccinate the poor. Because if you vaccinate us, the members of parliament, we can afford to pay for it. But my people in Rwanda cannot afford. Therefore, I request that government allows the private hospitals to get the vaccines. For those who can pay, we go there and pay. And for those who cannot afford, be vaccinated by government. Thank you. Information?
Honorable Laura. Honorable Laura.
Thank you very much.
Honorable Laura, disability.
Right, Honorable Speaker, this tent was forgotten.
Thank you, Madam Speaker. My name is Kanushu Laura, National Woman MP, Persons with Disabilities. I must say that as persons with disabilities, it's difficult to catch the eye of the speaker because we can't line up but thank you for giving me the opportunity. First of all, I want to appreciate the Prime Minister and the government for some of the persons with disabilities, where we have received reports that they have received the relief funds. We appreciate the Prime Minister for that. I want to refer to the Prime Minister's report. I think there was a statement that was made by the Minister of Gender on media, and this was misunderstood by most of the clerks and the RCCs. Because when some of our people with disabilities who fall within the target categories registered themselves for the relief fund, they were told that they are not a vulnerable group because they have the disability grant. I would like to urge the Prime Minister in future to be very clear that this was not a poverty eradication program, but it was a relief fund that was targeting certain categories, of which people with disabilities are also beneficiaries. We have people with disabilities in markets. You know that in most towns, the cobblers, the shoe shiners are people with disabilities. So I would like that next time the Prime Minister clarifies so that our people are not tossed up and down. I would want to say that people with disabilities some of them have other health issues. For example, people with epilepsy, people living with albinism, and people with mental illness. And therefore, they're more prone to COVID. I want to appeal to the Minister of Health that as you're vaccinating the people, please give people with disabilities first priority because they already have underlying diseases. I want to say, to ask that in movements, which also the Prime Minister's report touches on, the President only gave directions for pregnant women. But I want to say that for a sick person with disability, because while we have COVID, we have other diseases, security people should be able to allow a disabled person to take a border. Because while you're telling people to walk, these people cannot walk. So let them be allowed, especially if they are going to like a hospital, to use borders. The last time we were here, the Prime Minister talked about beds, and she indicated that most of the beds will be manufactured here. I want to bring your attention the Persons with Disabilities Act of 2020, and to urge the Prime Minister to make sure that the beds that are going to be manufactured here are accessible to persons with disabilities. If I have a bed this height and I'm sick and I'm a disabled person, I can't climb that bed. And the law that provides for those beds is with us. I also want to
Honorable Bigaro.
Lastly, Madam Speaker, I want to request all members of parliament, especially those on the National COVID Task Force, that please make sure that you see persons with disabilities included in the programs of the
Obigaros.
Thank you, Right Honorable Speaker.
Thank you so much, Honorable Speaker.
Hey.
Rose Obiga, woman MP Terego. Honorable Speaker, I want to thank in the same vein the Prime Minister for the presentation, but straight away I want to borrow from the presentation of the Minister for Health. Terego district does not have a district hospital, nor do we have an ambulance, no pickup, even motorcycles are a problem. We have many of our brothers and sisters who have perished from COVID and other sicknesses. Their bodies are put under a carpet mortuary. We don't have any ICU, yet we are managing over 150 COVID cases. I would beg Terego be considered as an emergency for construction of a district hospital, and we should be given an ambulance flagged ICU center quickly if possible. I know government is working under scarce resources, but kindly consider us. Honorable Speaker, lastly, I want to talk about the stop of giving out food that it should be first tested by government. Honorable Speaker, you see many people are buying food and it is not being tested. Yet our people are calling day and night. The money is only given in municipalities. In this instance, I'm begging, there should be open roof given to us so that we can support our people in this desperate situation, other than hearing them dying. Thank you. Nakawa?
Right, Honorable Speaker.
Nakawa. That is Balamweso. Nakawa.
Right, Honorable Speaker, I want to appreciate you for giving me time. My name is Balimwezo Ronald Nsuga, Member of Parliament for Nakawa East. Right, Honorable Speaker, I've been taken by surprise to hear that the vulnerable people of Nakawa Division have been given food. And the Prime Minister has today.
Did you hear very well? Was it food or cash?
Have been given relief money to procure food. And today, the Right Honorable Prime Minister has laid on table a list of their names. Nakawa, located in Kampala city, which is the epicenter of COVID, has quite a number of vulnerable and poor families. We have over 200,000 vulnerable families, but only 27,892 families were identified to benefit from the COVID money. I don't know the parameter that was used to identify those people. Right, Honorable Speaker, I have traversed my constituency, but I've just found a handful of them having gotten that money. While as I appreciate the use of ICT by government in making payments to vulnerable people, I believe this system has. Madam Speaker, I pray that you accord me another 2 minutes because I have facts here that I'm going to lay on table. Right Honorable Prime Minister affirmed that for avoidance of doubt, the system was designed to ensure that only one telephone number registered against a particular need can be paid. Similarly, on page 30 of the original report, bullet 9, the Prime Minister also asserted that verification process also ensured that duplicate and non-existent beneficiary names and telephone numbers were weeded out. Right, Honorable Speaker, with me, I have evidence of one Gavin Opira of telephone number 075 972 2955, who received relief cash twice. I have talked to this fellow and he has accepted to declare. Information accepted.
Right, Honorable Speaker.
Thank you, Honorable Member, for giving me the way, and thank you, Speaker. The additional information I wanted to give, Rutamagu Semakula is my name, a Member of Parliament representing Nakaseke South constituency. The additional information I wanted to give the Right Honorable Prime Minister through you, the Honorable Member, government borrowed $1 billion from International Monetary Fund. In addition to that, the UK government gave Uganda 1 trillion, which is, when you add $1 billion plus 1 trillion, that is an equivalence of almost 4.6 trillions. The Right Honorable Prime Minister is only talking about a part of almost 53 billions out of 4.6 trillion. So you should come out and give clear accountability, not just these small monies you are talking about. I thank you, Right Honorable.
Right Honorable Speaker.
As I
thank you very
conclude,
much.
Right Honorable.
Your time is over. You gave out your time. The person on the microphone.
Right Honorable Speaker.
Right Honorable Speaker, I have evidence. Honorable Speaker, I have evidence here.
Can you have a seat?
I have very important. Hello.
Right Honorable Speaker, I'm Brother Ephraim Buheju West. Right Honorable Speaker, I come from a rural constituency. I reside in urban Kampala.
What's your name?
The situation, Brother Ephraim Ganshanga Buheju West. Right Honorable Speaker, I want to compare the situation what I see in Kampala, where I stay, and in the village, the rural village, where we come from. The selection of beneficiaries and the people to be considered, Right Honorable Speaker, leaves a lot to be desired. We have got people with border, taxi operators, and all the other businesses like they stand. But Right Honorable Speaker, our people in the villages, they have contracted loans from SACCOs and banks. The banks are running after them to pay. They do not have consideration for giving them any leave when they are not operating. Right Honorable Speaker, I request, much as I appreciate what the government is doing, that the government comes up with a position on what these other business people in the villages are going through and versus what they will be able to do during the COVID-19 period. Thank you very, very, very much.
Madam Speaker.
Honorable Adeke Ann. Honorable Adeke Ann.
Thank you very much, Right Honorable Speaker. Please allow me to congratulate you. Hello, can you hear me? Can you hear me, Honorable Speaker?
No,
look at all.
Can you hear me, Right Honorable Speaker?
Yes.
Thank you very much, Right Honorable Speaker, for giving me an opportunity to contribute virtually. I'd like to congratulate you upon the assumption of that great office. Congratulations very much. Right Honorable Speaker, I just have two concerns this evening that I feel that the Right Honorable Prime Minister should address. The first one is the selective manner in which the security, the GISOs, collected names of beneficiaries. Right Honorable Speaker, it has been it has been done in a very divisive way, and most of our people are reporting back that it has been done to favor only those whose names are registered in the famous yellow NRM book. So I want to know from the Right Honorable Speaker, is the NRM government going to divisively deliver services to our people? Are they only going to favor their party members? Because COVID-19 is not choosing whether NRM or FDC or the other party. Secondly, Right Honorable Speaker, I had a very interesting discussion on the floor, a point that was raised by Honorable Prosi about access to vaccines by people that can afford them. Right Honorable Speaker, we all know the risk that Parliament will run in being classified as a team, as a group of people that are only going to favor the rich. We know there is vaccine inequality that is ongoing. I want to know the circumstances under which a wealthy businessman who made a donation to the government, which was received by the Right Honorable Prime Minister, under which circumstances were 2,000 of his employees vaccinated. This in light of the fact that frontline medical workers who are on the front line fighting COVID have not received vaccines. People living with comorbidities have not been prioritized, and they are at a higher risk than the general population. Madam Prime Minister, under which circumstances did this businessman get 2,000 vaccines given to him and given to his employees? Is there vaccine equality or inequality? Is the statement that you are sending to Ugandans good? Are you saying that it is now for a privilege for only the rich who can afford it? Because this discussion must be made clear right from the start so that we know what to tell our people. Thank you very much, Right Honorable Speaker.
Thank you so much, Honorable. And the issue of only NRM supporters is a hearsay. That is subject to be confirmed. We cannot put it that it's only NRM supporters who are being treated. And the one of the rich man harm, the man got vaccines for himself, for his workers. The person behind, the other person behind, I can't see you. And then Joel, Shamim. Okay. There's a gentleman behind.
Thank you, Madam Speaker.
Yes.
Thank you, Madam Speaker.
Thank you, Madam Speaker.
Oh,
This is Afidra Olema Ronald, Member of Parliament for Lower Madi County. Madam Speaker, let me begin with congratulating you and the Prime Minister and the Vice President and all the appointed ministers, both on the government side and the opposition side, for ascending to the position of leadership and leading this House. Madam Speaker, I want to be on notice, special to the Prime Minister's speech, that she has categorically said to this country how government is running effectively the pandemic. The Prime Minister, I want to congratulate you for coming out clearly, one, with the intervention of giving cash instead of food. This has clearly shown to the public and this country that government can effectively use the resources that are entrusted into their hands, and there's a lot of savings that government has done. And this money which has been saved, I do believe, in the other areas being mentioned here in the House will be converted and effectively to be used in those areas. Madam Speaker, again, I want to bring to your attention that I'm coming right from my constituency. The categories of people that have been highlighted by the Right Honorable Prime Minister to benefit from this relief, the House has clearly said that the categories were not clearly inclusive of all. Like my constituency is called Lower Madi. I have so many borders who've been challenging me that they are under the categories, but they have not received the relief. And therefore my appeal, my appeal through you, Madam Speaker, is can government extend the relief to all the districts where the categories of these beneficiaries exist?
thank you, Madam Speaker. For the record, Joel Senyonyi from Nakawa West. Madam Speaker, for starters, I think that the Prime Minister is being wishy-washy as far as vaccination is concerned. When you look at her plans, she says, yes, we shall get some vaccines from COVAX and so on. Can we get some specificities? Because, I mean, it's all over the world, you know, countries elsewhere are opening up because they have vaccinated majority of their population. And so it looks like vaccination is the panacea. Can we have a clear target, a clear aim? Madam Speaker, there's an old adage that if you aim at nothing, you'll hit it each time you try. I request the Prime Minister to have a clear aim as far as vaccination is concerned. Two, Madam Speaker, the Prime Minister prognosticated that giving out of money, relief money to the vulnerable would have ended by 14th of this month. 14th came and she pushed the date to Friday 16th. Today is 21st. In Nakawa, where I come from, they targeted 27,673 people. As of today, only half of those people have gotten this money. It appears to me that the Prime Minister is not in charge because each time she's giving excuses of, you see, the lists are not organized and so on. Madam Prime Minister, please be in charge. The buck stops with you. Finally, Madam Speaker, the Prime Minister in her statement told us that there is a purchase of 282 double cabin vehicles versus 38 ambulances. Madam Speaker, I think there's a problem with our priorities in this country. You don't need to be a professor of medicine to know that in a health challenge, a health emergency like we are having now, we need more ambulances than we need double cabin trucks. And so I invite the Prime Minister to measure on measures. I need to repeat that. I invite the Prime Minister to measure on measures and to minor on minors. I thank you.
Dr. Magolo.
Thank you, Right Honorable Speaker.
Maybe we can have five people in each microphone.
Right Honorable Speaker.
Because now I can't see the people.
Thank you, Right Honorable Speaker.
Malende, Dr. Magolo, and then one from each.
I'm Shamim Malende, the District Woman Representative for Kampala. I rise to echo the voices of the people of Kampala, especially during this time when Kampala is the epicenter of the deadly COVID-19 pandemic. Madam Speaker, the people of Kampala are dying of COVID-19. They are dying of hunger from within their houses, yet they see no strategic plan that has been put in place by the government to see a way out. I expected the Right Honorable Prime Minister to address an exit plan. Secondly, the people are being arrested on a daily. People from the ghetto, the border riders, the tax operators, the market vendors, name it. And they are being detained in these congested police cells and prisons. So the question is, I expected the Right Honorable Prime Minister to address the issue of congestion, vis-a-vis prevention of transmission of COVID-19. I beg to submit.
Maintain social distance.
Right.
Thank you very much,
Right
Honorable Speaker. I am
The
by the
next-
names
Next is the other
Magolo
side.
John Faith, and
Right.
I am rising on the issue, on the report by the Right Honorable Prime Minister on the page 7 about the disbursements of resources in the lower local governments, 150 million in the districts, 300,000 shillings to the VHTs, and 100,000 to the village task forces. That information comes to us at a time when we are part of the task force in our communities, in our districts. And when we were there, what was all in place was lamentation about lack of funding to these task forces. And we as members of parliament, as usual, we became the punching bags to see how to fund part of the processes of the task forces.
All right.
Are you?
Dr. Magolo, your time is over.
Thank you. Thank you, Right Honorable Speaker.
Thank you.
Thank you.
Right Honorable Speaker. My name is Awuma Kenny, one member of parliament for Kwania District. I want to thank the Right Honorable Prime Minister for the statement issued on government intervention on COVID-19 in Uganda. Right Honorable Speaker, I want to inform this House that government measures undertaken to distribute the 100,000 to the vulnerable Uganda has not met its intended purposes. Right Honorable Speaker, in my constituency, where I come from, which is not the beneficiary of this relief fund, my people have been ravaged with the flood, which is due to the rise of water level from Lake Kwania, Lake Kyoga, and River Nile. This is the rationale for the relief support from the Office of the Prime Minister, which has not been affected. Right Honorable Prime Minister, Right Honorable Minister,